Wait.
What's wrong?
What are you trying to do?
I'm trying to kiss you. Come on.
Wait.
What? Every time I try to kiss you, hautaki ni nini mbaya?
But chill out. Tunaonekana. Tuko in a public place.
This is a very secluded place. No one can see us here.
Let me just pick my phone. Alright? My phone is actually ringing. Hello?
His phone is not even ringing.
Hello?
Hey, your phone is not even ringing.
I don't know what's wrong with him. It's been 3 months and he hasn't even kissed me. I'm trying to kiss him. He doesn't want to kiss me. I don't know what's wrong.
What are you gay?
Say he's gay, dating a gay man.
But if he's not gay, you start with abdomen. What? You have death breath. What's trying to say?
Ha!
Hey, man, bro, umechekea video lakini. Hey, man, ndio mjo,
But inaingiana na topic ya leo.
Bana, death breath. Ilikuwa ito death breath.
Bad breath.
Foul breath.
Mdomo, odori.
Kutupa. Odori.
Kutupa.
Bro, kusema odori.
Ni order.
Order. Ndio hivyo sasa. Hello good people. Welcome to GegoBase. This is episode number ngapi daktari?
Kobole.
Oh, number 5.
5.
That's nice. Okay. Asa leo tuta discuss kitu very common, okay? Bad breath, kunuka kwa mdomo, okay? It's something that is experienced very commonly and guys are usually worried, yeah? Indeed, kunuka kwa mdomo, bad breath even affects your esteem, yeah? Even you are the way even you are vile kujiaminia mbele ya watu, even unajibeba to really affect you, okay? So now we're going to discuss the causes. Daktari, I think you're going to take it off,
Okay.
What causes bad breath, na namna gani pia tuta manage baadaye tuta discuss.
Causes of bad breath. Number 1, we look at the causes inside the mouth. So number 1 is cavities. Number 2, the reason we do cleaning, the calculus, what we call tartar, plaque, some infections of the gum. So when you have some gum disease, periodontitis, gingivitis, that sort of thing. I think here in the mouth, or if you have maybe like a tumor in the mouth,
malignancies,
they may cause that. And there are some causes that are outside the mouth, deeper when you go to the throat, throat infections, again malignancies.
Yes.
Can take us through another few maybe.
Yes. Now, I think I don't know about your approach, Daktari. I think when someone presents you with foul breath, okay, I think the first source to eliminate inakuanga mdomo kwanza, within the mouth, okay. I think extraoral causes usually the last after we have ruled out mdomo kuko sawa, there are no cavities, it's actually a clean mouth. That's when we now entertain stories za nje, si ndio? Yeah, now extraoral causes, there are very many, okay, but I'll just mention a few, okay. Patients or watu ambao who have what we call chronic sinusitis, infection huku za mapua kwa ndani, si ndio? People ambao tend to chakula kinarudi, unaitanga je ugonjwa regurgitation, hiyo jina kwa nimesahau. So such patients or such people tend to have bad breath, okay? Now, let me give a more common instance, okay? People with uncontrolled blood sugar, chronic diabetes, okay, tend to have a very peculiar type of foul breath or not normal breath. It's usually fruity smelling, okay? There's a reason for that, okay? With uncontrolled blood sugar, you may have a metabolic condition that has you inafanya sasa unakuwa na hiyo fruity smelly breath, okay? Other people who actually have foul breath are people who are actually kidney failure, daktari, okay? People with chronic renal failure tend to have foul breath, even tend to have their lips and the mouth tend to be very dry, okay? So people with such imbalances, with dry mouth is not actually very good, okay? And that's even in the management the doctor is going to discuss. Saliva and basically fluids within the mouth are quite key in actually curbing foul breath, isn't it, doctor? Okay, so so the causes intraoral is the first line of defense. Second, tunaangalia sasa extraoral, okay? Now, daktari, take us through how will you manage a patient who has foul breath?
Okay, so basically for management, it depends the cause.
Yes, yes.
So it starts all the way from diagnosis. You have to find out why this person has that bad breath. So assuming the intraoral is all dental issues. So first you do cleaning, so you remove all the tartar, the plaque, deal with the infection, the gum infection, the tooth infection. By the way, abscesses could also lead to that.
Oh, yes, yes, yes.
So so if you have an abscess ni usaa, that pocket of pus. So you deal with that, eliminate it. Now the cavities, meno zimeozaoza, clean off, do your fillings. So you make sure the dental hygiene, the whole formula is healthy.
Yeah, up to par.
Now once that is done, then chances are most of the time you will have dealt with the problem of halitosis. Now secondly, assuming umefanya hiyo kazi yote na bado jamaa kuna the same problem, sasa you start investigating other systemic causes. You go backwards, from the mouth backwards to the throat, down to the abdomen, and now hizo madiabetes ambazo my colleague hapa amesema. So if the cause is because of the sugar imbalances, kidney failures, then all those things have to be managed. That means you need to work hand in hand with a physician. So that means the diagnosis bit of all this is very important. Now there are some things that you as the patient can do at home to take care of that. So as Daktari has mentioned, number one is to make sure that there's a lot of fluid circulating in your mouth. So drinking water constantly, tembeaga na kachupa. Tembeaga na kachupa, just drink water. Make sure there is some fluid in your mouth. Using of mouth washes, mouth rinses, it's non-specific. There is no specific mouth rinse that is good, but of course you want some things with some flavor hivi kidogo. So when you rinse your mouth, that flavor can be left in your mouth. Of course, good oral hygiene has to be paramount. You have to make sure you brush your teeth at least twice a day. Make sure you floss at least every night. I mean, flossing, hizo machakula zinabaki in between the teeth could actually be a cause of the same cavities and the bad breath. And I think also you can use sugar-free gum.
Yes, gum is quite good.
Sugar-free gum is good. So because it causes the glands, the salivary glands, to be active and sort of keep consistently releasing saliva. That saliva is important for the self-cleaning mechanisms of your mouth.
Yeah.
I think I haven't left anything out.
Yes, I've just remembered something, Daktari. I think how can one know if you have foul breath? I think I've been asked that question severally. Okay. Yeah. How does one establish a foul breath? Okay. This is what I will say. If you have something to add,
utaendelea, but there's that thing of it being psychological.
Yes. When it halitophobia, whatever they call it. Now, baseline. How do you establish if you have foul breath? Okay. Number one. Okay, this one is kinda it's subjective and objective. Okay, you can confide in your partner. Okay, unamuuliza, how do you perceive my breath? Okay, just by the smell. Kama yako ni mbaya ni mbaya, kama ni nzuri ni nzuri. I don't think there's a fine line.
Sasa unajua ya bei manzeati. Hiyo ni trick.
Lakini kama ni mtu wako atakwambia ama ni vipi
Lakini atakwambia lakini wewe muda.
Okay, that's true.
But anyway, jaribu tu.
No, the personal test. How do you confirm if you have a foul breath? You lick the back of your palm. Okay? Just lick the back of your palm, let it dry. Okay? Wewe mwenyewe nusa. Okay? Whatever you perceive is actually close to the truth, or if not the truth. Okay? I don't think you can confuse foul breath. So just lick the back of your palm, and now you can actually feel a certain scent. Okay? If it is foul scenting, you can just confirm enyewe hapa I've got foul breath.
Ni scent ama ni odori?
Ni scent ama ni odori? By na kwanga odori. Tutatuambia kwa comment section. Okay. So now, Doctor, I wanted to discuss now. There are some patients who actually think they have foul breath. Okay, been a psychological issue or even a past history, like alikuwa na foul breath na bado sai haamini amepona. Tuambie, what's your take on that?
I mean there are guys who are just naturally fixated on actually cleaning their teeth. Jamaa ana brush mara ka 40. Anakuja anakuambia, I've had several cases. The patient is telling you, me daktari, I have bad breath. Then of course you jaribu to diagnose bad breath, but you are not capturing any bad breath on your nostrils, so inakuwa tricky. So you just have to do some scaling and reassure the patient, tell them, so you give them the same regimen. So you do the cleaning. It's psychological, but you have to manage it physically so that they feel it has been sorted.
More like placebo.
You can say that. So you do the cleaning, you prescribe the mouthwash, you give the oral hygiene instructions, and then you also encourage them to constantly chewing of those sugar-free gums. So inasaidia, so it works on them on the reverse. Hana bad breath, but akifuata hiyo regimen, then they feel much better and more confident about themselves. I mean, so kuna the ones who actually have it, but it is treatable, it's manageable, and I mean, I think we've sorted quite a number.
I think that's it, guys. Okay, any questions in the comment section, drop them. Maswali sindio, comments. Okay, we really try to cover a wide scope. We can't finish, okay, but I think we can tailor make something for you guys. Okay, thank you.
Maswali
hapo chini,
down. Beautiful. Love your smile, man.
Love your smile.